Hey y'all, in this Chiari conversation, just wanting to update you guys on the results from my MRIs for the brain and the cervical spine, and just fill you in a little bit. But first I want to start off with kind of a description of the operation, just in case anybody's wondering the process and any little details if you're having to move the direction of the surgery. And once again, I was diagnosed with Chiari Malformation 1, and I had a really bad syrinx that would have led to me being paralyzed from the neck down because I only had a few nerve fibers left. So for me, it wasn't optional to get the decompression surgery. So here's the update, and I'm going to start off with a description of the operation. Okay. So, and bear with me, I'll try to pronounce these words correctly. After adequate levels of general endotracheal anesthesia had been achieved, the patient was placed prone on the Wilson frame with the head fixed in Mayfield pins. The occipital cervical region was clipped, prepped, and draped in the usual sterile manner. The midline vertical incision made extending from above the inion to the level of C2. The incision was carried down through subcutaneous tissue. The paraspinous muscles were carefully dissected, free from the spinous process and lamina of C1 through C2. The muscles were also dissected free from the occipital bone and the foramen magnum. At this time, a suboccipital craniotomy was performed, measuring approximately 3 centimeters by 3 centimeters. The suboccipital bone was thinned, overlying the foramen magnum, and then removed using Chiari Syrinx. The lamina of C1, the spinous process, and lamina of C2 were also thinned and removed using Chiari Syrinx. A bilateral laminectomy was performed at C1 through C2. Microscope was brought in at this time, and the remainder of the operation was performed using the microscope with micro dissection techniques. The dura was open in a Y-shaped manner. The patient was found to have significant cerebellar tonsil ectopia. So my neurosurgeon said once he went in, even though it was 9 millimeters, when I did my MRI, when he went in, it was pretty bad. The arachnoid was incised. The arachnoid adhesions were carefully cut using micro scissors. Next, a patch duroplasty was performed using the Cook COOK bio-designed dural graft. And for me, I was told that pig skin was used for my dura patch. The dural patch was sutured to the patient's dura in a watertight manner using new roll-on, running, and interrupted sutures. The patient was given a Balsava after the closure, and there was no leakage of spinal fluid. Duragen was applied to the closure site. The occipital cervical region was closed in layers using vicryl interrupted sutures, and the skin was stapled. So in short, I had a suboccipital craniotomy, C1 through C2 laminectomy, and a patch duroplasty closure that was all done for my brain surgery for the Chiari Malformation and Syrinx. All right. So on the part where it said the patient was given a Valsalva after the closure and there was no leakage of spinal fluid. So I had to Google Valsalva, and just for you guys, it says it basically identifies bleeding. It says in some surgeries, like those involving the head and neck, the Valsalva maneuver can help reveal hidden bleeding points by increasing pressure and causing blood to flow from previously unnoticed vessels. So I guess that's just a means to ensure that there's no leakage of spinal fluid, there's no leakage of anything. I guess that's the process. So that's what that's about. All right, so now we get down to the nitty-gritty. So I'm going to discuss the findings of the MRIs before surgery, and then the findings of the brain MRI without contrast, and then the cervical spine MRI without contrast. All right, so as I stated before, Chiari malformation, 9 millimeters, and a really bad syrinx as well. Before surgery, of course, I had to get it because of the fluid in the spine, but my surgeon basically said, well, at least I won't have to worry about becoming paralyzed from the neck down because the syrinx won't get any bigger and shut off my nerve fibers. So that's what I was told. And he said, we'll just watch it like once a year just to see, if there's any changes. So my syrinx diagnosis findings before decompression surgery are as follows. The hydrosyringomyelia cervical spine is more prominent than seen previously. This is especially true after the interior cystic component, which measures 2.5 centimeters longitudinally by 11 by 7 millimeters compared to 1.7 centimeters previously and 8 by 6 millimeters. And that's the cervical spine MRI, which revealed those measurements from C3 to C7 of the syrinx. So that said, those two sets of MRIs were about 2 years apart, which means just like they say normally syrinxes, they actually grow. So within that 2-year period, mine actually did get worse. It got bigger and of course started to kind of, basically choke out the nerve fibers. And now, this is post-decompression surgery diagnosis and findings. It says post-operative changes of occipital cervical decompression. No features of tonsillar ectopia or cervical medullary flattening. Okay, I'm gonna read that again. So this is the diagnosis after decompression surgery. It says post-operative changes of occipital cervical decompression. So here's the changes after I had the surgery. No features of tonsillar ectopia or cervical medullary flattening. So of course my brain has the room that it needs to not be squeezed. 2 things to note. My syrinx was 11 by 7, which got worse from previously, but now it's down. So it was 11 by 7 millimeters, but now it's down to 1 millimeter. So if that's not a miracle, I don't know what is. All this math stuff, whatever, but I'm going to show y'all the picture for the true results. In my MRI results, you could see a huge mass of white. And then on the most recent MRIs, you see just this small twinge. And when I say miracle, I mean absolute miracle. Literally, my husband and I were at my neurosurgeon's office, and he's like, so here's the results. He was even like, oh my gosh, like so excited because it is a literal miracle. He never said anything about the syrinx disappearing. I literally, in my research, I've heard people say, I may have heard 1 or 2 people say, oh yeah, it disappears. I'm like, right, so it just disappears? But never would I have thought. Here I am thinking that it's gonna be there, but you know, maybe, you know, the fluids can flow better, but literally on my MRI, it literally looks like it disappeared, like a literal miracle. And that's why I said God is so good. So that's the main thing. It literally shrunk almost to nothingness, which is awesome. And then the second thing is, initially as large as it was from C3 all the way down to C7, but this little 1 millimeter syrinx is only from C5 to C6. So it was from C3 to C7, but it shrunk in size, and it's only from C5 to C6. So I just want to say God is all types of good. God is so good. I mean, I still do sometimes have the little like cold tingles, but in my mind, I am so thankful that the CSF, you know, the fluid is able to flow like it needs to. So I don't even have to worry about that anymore. And hopefully eventually it just completely disappears. So I am super thankful. I am super excited about that. And just to recap, the MRI of the brain showed a Chiari malformation 1 with 9 millimeter of cerebellar tonsillar ectopia. And yeah, although my Chiari was worse than expected during surgery, looking at my MRI results, my neurosurgeon said that everything regarding the Chiari malformation looks good. So not only did my syrinx shrink, my Chiari looks absolutely amazing. Absolutely amazing. And just to recap, I had an suboccipital craniotomy, which was performed, and the measurement was 3 centimeters by 3 centimeters. That basically made space for my brain. And then a patch duroplasty was performed, as well as the C1 and C2 laminectomy. So skull piece removed, C1, C2 of the spine removed, gave space for my brain to not be squeezed so that I can finally have a sense of normalcy like other people. Then on top of that, my syrinx shrunk in size, and then it's only a little bit on the C5 to C6. So those are my results for my MRI. And like I say, it's been almost an entire year since the surgery. I am so thankful. I am, like I say, if you have to go through this, I completely understand where you're coming from. I get it. I was so afraid. I was so scared of doing the surgery. But I am so grateful. I am so thankful that I did. My neurosurgeon, who does different types of surgery, like when I go into his office, I'm seeing other people with incisions further down. Like, I think he does a lot of stuff regarding surgery, but I'm so thankful to have him, that he did such a great job. Like, literally, God guided his hands. He did such a great job. The healing process, you know, the symptoms subsiding. Like, I am very happy. I am very happy that I had this surgery, and mainly, above all things, that I don't have to worry about becoming paralyzed. So that's my those are my MRI results, guys. Yeah, I'm elated. I'm super happy. Like, literally, the moment I came out of the office, I'm just like, thank you, Jesus. Everything went well. The surgery was a success. The surgery was a success regarding my Chiari, regarding my Syrinx. I feel like, I now have an opportunity to live life, and I've been living life, you know what I'm saying, since the surgery. But this is just more of a confirmation that now, okay, now you can do better, you can focus more, you can, and a lot of the symptoms have subsided. One thing that I've always had issues with is, memory. So I don't know, I'm just gonna wait and see. It's not a full year yet, but I'm just gonna continue to wait and see and keep you guys posted on the greatness. Like I always say, I know dealing with Chiari, dealing with the Syrinx is hard. Please know you are not alone. I've been slacking, but I'm gonna try to do my best to continue to upload videos, especially on little things for people who choose not to do the surgery, if they're looking for ways to kind of help like manage back pain, manage different little issues from the Chiari malformation. Like I said, I'm super excited. If you guys have any questions, if you guys have any comments, I'm coming up with some new ideas of things I want to get into that I want to share with you guys. But please know, like I said, you're not alone. If you ever need to talk, you're welcome to message me. You're welcome to comment, in some of my videos. I'm always open for communication. If you get a chance, I'll leave the link to this book that I found on Amazon, which is really great, especially if there's family members, like if you have a child or a family member who has Chiari malformation. That book will be of great assistance for you. Overall, I'm just excited. I'm happy. I'm elated. Still just trying to, be protective of falls or any trauma, because, of course, I've got that pig skin back there, that skull is missing. So I still try my best to ensure that I'm paying attention, because I don't want, any little things to happen. So overall, I'm sorry, guys, I'm just rambling now, but I just want to say God is so good, and I'm so thankful. The surgery was a success, and that's proven in the findings of the MRI. So anyway, leave your comments, leave your questions, and I'll talk to you guys soon. Bye.